Hi, my name is Heidi Major, and I'm going to go over, along with Gina Van Pelt and Nikki Barney, we're going to talk about mononucleosis. My portion is etiology and reservoir. So let's start with a little history and about how mononucleosis came to be. It was only first diagnosed less than 200 years ago, which is somewhere around like 127 years ago. And it's been only around a really short time compared to other diseases like leprosy, which is mentioned in the Bible, or polio, which has been around for several hundred years. Mononucleosis was first given a name and a list of symptoms that went along with it in 1889. It was called glandular fever in the beginning because of the symptoms the patients exhibited. In 1920, glandular fever was renamed mononucleosis by the researchers Sprint and Evans. Then in 1932, researchers Paul and Bunnell saw that serum from patients presenting with mononucleosis showed heterophilial antibodies. This discovery allowed doctors to be able to perform blood tests to correctly diagnose a patient suffering from mononucleosis. Lastly, in 1964, a group of doctors consisting of Dr. Epstein and Dr. Barr discovered the virus was a member of the herpes family, and the virus was named after them. So what is mononucleosis? It is a virus. It's caused by the Epstein-Barr virus that was previously mentioned and belongs to the herpes virus family. Its genus is Lymphocytovirus, and its species is the human herpes virus 4. This family of viruses includes those that cause cold sores, chickenpox, and shingles. Most people are infected with multiple strains of the herpes virus family, and it is responsible for diseases like mononucleosis, infectious mononucleosis, Burkitt's lymphoma, and nasal pharyngeal cancer. Since the Epstein-Barr virus is a virus, its structure is very simple. Components of the Epstein-Barr virus are the virus has a four-layer structure, which contains a core where the double-stranded DNA is stored. There is an icosahedral-shaped capsid. You can think of it as having like 20 sides to kind of help you see it, the shape of it. Next, there is the tegument, or the outer protein coat, which is then covered by the lipid bilayer envelope. This layer also contains the glycoprotein spikes the virus uses to attach to the host cell. This virus causes disease by lysis of the host cells to release virins, or by continuous replication. This constant replication is due to the Epstein-Barr virus DNAs forming an episome, which becomes circular and joins together and starts the replication process. The virus is then shed into the infected host's saliva, making the virus available to be taken up by the beta lymphocytes and then spread. For the Epstein-Barr virus to be able to affect a host cell, the host cell must be that of a human, and more specifically, a lymphatic cell or an epithelial cell located in the mouth. The virus can maintain latency in the beta lymphocytes within the salivary glands for the lifetime of the person who has been infected. Reactivation of the Epstein-Barr virus can happen at any time. The reactivation can be symptomatic depending on the immune system of the host, but it is usually asymptomatic, where the virus can still be spread. It is a very infectious virus, and about 95% of all adults have been infected with the Epstein-Barr virus, or known as herpes 4.
Hi, my name is Nikki Barney. I am originally from Southern California, and I am doing a presentation along with Gina and Heidi on mononucleosis. I live in Rexburg, and this is my fifth or sixth semester here. I live with just one other roommate at the moment, and we both have cats. So I guess there's 4 of us living in the apartment. I will be talking about the signs, symptoms, and transmission of mononucleosis in this presentation, and I hope to have a good time with everybody. Thanks for watching. There are many signs and symptoms of mononucleosis. Mono is hard to distinguish from other common viruses, such as the flu. If your symptoms don't improve after 1 or 2 weeks of home treatment, such as resting, drinking a lot of fluid, and eating healthy foods, go see your doctor. Typical symptoms of infection usually appear 4 to 6 weeks after you get infected with the EBV virus. And the symptoms may develop slowly or may not occur at all. Most people will get better in 2 to 4 weeks. However, some people may feel fatigued for several more weeks. Occasionally, the symptoms of infectious mononucleosis can last for 6 months or longer. Some common signs and symptoms of mononucleosis may include extreme fatigue, sore throat, perhaps a strep throat that doesn't get better even with antibiotic use. You will have a high fever and swollen lymph nodes in your neck and armpits. More signs and symptoms of mono include swollen tonsils, headaches, skin rashes, loss of appetite, night sweats, and occasionally your spleen or liver may also swell, but mono is rarely ever fatal. Mono usually isn't very serious. Most adults have been exposed to the EB virus and have built up antibodies. They're immune and won't get mono again. Though there can be complications these complications may be more serious than the disease itself. Mono may cause enlargement of the spleen. In extreme cases, your spleen may rupture, causing sharp, sudden pain in the left side of your upper abdomen. If such pain occurs, seek medical attention immediately. You may also have problems with your liver, like hepatitis, jaundice. Though less common complications of mono can include anemia, thrombocytopenia, heart problems, and complications involving your nervous system, such as meningitis, encephalitis, and Guillain-Barré syndrome. Swollen tonsils can also be so swollen they can block breathing. The EB virus can cause more serious illness in people who have impaired immune systems, such as people with HIV or people taking drugs to suppress immunity after an organ transplant. I'm going to talk about the transmission of mononucleosis, but first, some background. Most people have been exposed to the virus as children, and as a result of exposure, they've developed an immunity to the EBV. It is of note that most people who are exposed to EBV don't ever develop mononucleosis, and the incubation period for mono is between 4 to 8 weeks. During an infection, a person is likely able to transmit or shed the virus to others for at least a few weeks, and possibly longer, even after symptoms have disappeared. Research has been shown that depending on the method used to detect the virus, anywhere from 20% to 80% of the people who have had mononucleosis have recovered will continue to secrete the EBV in their saliva for years due to periodic reactivation of the viral infection. Since healthy people without symptoms also secrete the virus during reactivation episodes throughout the lifetime, isolation of people infected with mononucleosis is not necessarily possible. It is currently believed that these healthy people, who nevertheless secrete the EBV particles, are the primary reservoir for transmission of EBV among humans. EBV is the most common cause of the infectious mononucleosis, but other viruses can cause the disease as well. Typically, these viruses spread most commonly through bodily fluids, especially saliva. However, viruses can also spread through blood and semen during sexual contact, blood transfusion, and organ transplants. As stated earlier, the main form of transmitting the disease mono is spread by person-to-person contact. Saliva is the primary method of transmitting mono. which leads to the infection of the B lymphocytes in the mouth and throat. Infectious mono developed its common name of the kissing disease from the prevalent form of transmission among teenagers and young adults. A person with mono can also pass the disease by coughing or sneezing, causing small droplets of infected saliva and or mucus to be suspended in the air, which can be then inhaled by others. Sharing food or beverages from the same container or utensils can also transfer the virus from one person to another, since contact with infected saliva may result. In this case, sharing isn't caring. Since symptoms develop long after an infected person begins shedding the disease, mono can spread fast and silently, which is why it is important to learn how to take precautions, which will be discussed in further slides.
Hi, my name is Gina Van Pelt, and I'll be talking about the mono disease and the prevention and treatment. Hope you guys like it. Thanks. Treatment is really minimal for mono, and there isn't much that can be done. The most obvious is rest and limit the amount of physical activity you do. Since mono is transmitted through saliva, and if you are infected, then you cannot kiss people, don't share food or drinks, mascara, dishes, and lip gloss. The EBV virus can stay in your saliva for months after being infected. There is no vaccination for mononucleosis, so this is a disease your body needs to learn to fight off. Regarding control and prevention, most people get infected with Epstein-Barr virus at some point in their lives, but never get mono symptoms. An interesting fact about this virus is that it is transmitted through direct contact with saliva. That is why it is referred to as the famous kissing disease. However, it cannot be spread through blood contact or casual contact, meaning you can live in the same house with a person who has mono and never become infected with the virus. According with Dr. James Stickelberg, professor of medicine at Mayo Medical School, most people who have mono get it only once. Rarely, however, mononucleosis symptoms may recur months or even years later. Once you are infected with EBV, you carry the virus, usually in a dormant state, for the rest of your life. Periodically, however, the virus may reactivate. When this happens, the virus can be detected in your saliva, but you are not likely to become ill. Rarely, reactivated EBV may cause illness in people who have weak immune systems, such as those who have AIDS. If you are experiencing signs or symptoms of mononucleosis, such as fatigue, weakness, fever, sore throat, and swollen lymph nodes, and you've had mono before, consult your doctor to determine the cause of your current symptoms. Keep in mind that many other conditions, such as hepatitis and toxoplasmosis, can mimic the symptoms of mononucleosis. Remember that coughing and sneezing, or even by sharing a glass or food with someone who has mono, increases the risk of obtaining the virus. A person who has a weakened immune system may be at a higher risk also for mono.
Take me down to the riverbed. Take me down to the fighting end. Wash the poison from off my skin.